gross anatomy or microscopic anatomy. I believe you all clear about this. Gross anatomy means anything you see with your vivid eye and naked eye. You don't need to use any microscope. And once you start using the microscope and studying the cells and smaller things, it will go into the microscopic anatomy. And microscopic anatomy can be histology or cytology. Cytology is the study of fluid, microscopic study of fluid, and histology is microscopic study of tissue. So we are clear, I believe.
Recording in progress.
Systemic anatomy, regional anatomy, again, that's not a big deal. Gross anatomy, microscopic anatomy, that's the difference. And don't worry about this anymore. It's not going to be in the exam. And we understand we have trillions of cells in our body. So that's one knowledge I want you to take. How many cells in our body? Trillions. So that's number one. And number two, which cells contribute the most? Our blood cell, which is the red blood cell, which is also called erythrocyte. So that's another information. A human being is made of trillions of cells, and red blood cell is the major component of these trillions. So that's the information. It will not be in the exam, but I think that's useful for life. And structural organization start from the chemical level, like carbon, hydrogen, nitrogen, they combine together, carbohydrate, fat, proteins, lipids, and everything. And then they will organize into a cell, C-E-L-L, cell. A cell is the basic living structure. And a group of cells which has similar function group together to form tissue. And we have completed our tissue lecture. Although there are trillions of cells in our body, we only have 4 types of tissue. These tissues are epithelial tissue, connective tissue, nervous tissue, and muscle tissue. So it doesn't matter 30 or 40 trillion of cells in our body. We try to group them into 4, which is what I said. And if these tissues group together and they form organs like cardiac muscle tissue, they group together to form the heart. The blood vessel tissue, they group together to form blood vessels. And connection of this heart and blood vessel, we get the cardiovascular system. Now we have multiple systems in our body, and human being is supported by all these systems. So these are the systems we have to study. This page is not important for the exam, for the sake of the exam. This is just what we need to go through. And don't forget, right side, you put yourself in the patient's position, you put yourself in the skeleton position, you put yourself in the cadaver position, the right side, and once you are there, the right side is right side. And this is right side, this is left side. For the eye, this is the right eye, this is the left eye. And I believe you all remember lateral and medial, proximal and distal, anterior and posterior. So these terminologies, because we are going to use it again and again, and therefore they are important. And if you look at that, if I give you a diagram, I want you to say, this is the right kidney, this is the left kidney. This is not the right side, this is the left side, because we put ourselves in that diagram. And again, superficial and deep. I believe it is easy for you guys because I have seen your scores for the homeworks and you all have done well. But I want you to take that knowledge because later lectures we will be saying superficial, deep. deeper. An axial skeleton, appendicular skeleton, that's no brainer. And I believe everyone has seen this. Hey, here, a little bit of repetition about coronal plane, sagittal plane, and frontal plane, transverse plane. So transverse plane, everyone gets confused to some extent with the transverse plane. And here, this is the transverse section. This is written here liver, and this is written spleen. Liver is on the right side of the body, and spleen is on the left side of the body. So right and left, don't get confused. Whenever you, unless mentioned otherwise, a scan or cross-sectional imaging, CT scan, MRI scan, a scan is in anatomical position, and you put yourself in that scan, and this is your right side, and this is your left side. Sagittal plane is a bit more easier, and coronal plane, again, like from very front to the back. So this is only one plane, and we will say anterior-posterior or posterior-anterior, because it is one plane, it is the chest X-ray. But once we go through the multiple plane, like in this is the right orbit, this is the left orbit, this is the right nasal sinus, this is the left nasal sinus, and this is the right side, this is the left side, and it's multiple plane going from front to back. It is called coronal plane now. It is no longer called anterior-posterior plane. Sagittal plane, if it is going multiple section from one side to other side. If it is only one view, then we call it lateral view, but this is the sagittal view. Body cavities, dorsal and ventral. I'm not going to repeat that. And 4 quadrants of the abdomen, I believe you all get it, like midline through the umbilicus, horizontal line through the umbilicus, divide the abdomen into 4 quadrants. The importance is which organ is where. And if somebody say, I got pain, your question is, where is the pain? If the pain is in the right upper quadrant, then you will be thinking about the gallbladder and liver. If the pain is in the right lower quadrant, then you will be thinking about the cecum and appendix. Left upper quadrant, then you will be thinking about the stomach and colon. So that sort of stuff. So this information is important, especially when you get into the clinical practice. And 9 regions is a little bit more detailed. And I want you to grab this information. It is in our textbook. Because we will be, one day, we will be someone, a group of a team, which will be looking after this sort of injury. And we need to communicate each other in an efficient way. This is the proximal tibia, upper part of the tibia, proximal tibia. This is the distal femur, because lower part of the femur. Proximal tibia, distal femur, and the kneecap, patella. I'm going to skip it. And just have a little look about how do we prepare a slice, histology slide. So yes, depending on the department, depending on the tissue, depending on the likes of your senior and bosses, it might be slightly different. But the thing is, whenever you get a tissue, piece of tissue, let's say from the operating room, they take a tumor from the patient and you get it, then what you have to do is you have to fix it. Fix it means preserve it. Why do you want to preserve? Why do you want to preserve with chemicals like formalin? To preserve the cell, to stop the cell metabolism, to stop autolysis, to kill bacteria and viruses. And then you have to dehydrate the tissue. You have to embed the tissue. You have to get the tissue very thin so that the light can penetrate through the tissue you have sliced. And then you stain with the eosin and hematoxylin, Chen-Easley, which is the basic stain, and you look under the microscope. So I want you to have just a little bit basic idea about how do we get a microscopic specimen. And therefore these microscopic slides, they are expensive. They are really expensive. And finally, you know, we have a pleasure to just look at this microscopic specimen, nothing more than that for us. But the way they have to do is multiple steps and make sure nothing got damaged during the processing. So that's, I'm going to stop here and I'm going to next lecture, which is cell and tissue lecture.
All states rehab.
Oh, I'm sorry. All right, this is the tissue lecture. Again, like we are just revising. So we will not spending a lot of time on this tissue lecture, but you have seen cells, and cell is the basic structural unit of living. And a group of cells with the same function, they group together to form tissue. Yeah. So as we saw, like trillions of cells in our body, they have similar function, and therefore we will group only 4 types of cells and 4 types of tissue. And tissue, there are 4 types of tissues in our body, and our body is made of nothing more than this 4 types of tissue, which are epithelial tissue, connective tissue, muscle tissue, and nervous tissue. So this is the information. So at this point, we just need to swallow it. There is no way out. So whenever you see a tissue, a piece of tissue, you are going to think, full. It will not come out more than that. So if you see a piece of tissue, if you look at microscope and look at the tissue, you will be thinking only 4 types: epithelial tissue, connective tissue, muscle tissue, and nervous tissue. Cell, cellular structure, we didn't talk much about the cell. We just say, hey, very basic about the cells. And I don't think we need to. We are teaching anatomy, but if you want me to go through a lecture about cell, basic of cells I can do, but I just wonder, we just move on. A cell is the smallest living unit in our bodies and organelles. These are the little organs, but let's stay away from that. Like, we are going to classify everything we see in anatomy. So like a human being can be classified according to the sex, according to the age, according to the color. And we are classifying tissue into 4 types. So only 4 types to remember: epithelial, connective, muscle, and nervous tissue. Look at the microscope, and this is what you see. It is a reminder. If you look at this, this diagram, this slide, and now what you are seeing is multiple cells. Why do we say multiple cell? Because we are seeing multiple deep purple color nucleus or nucleolus, and the cells are facing like onto the sea, empty sea on one side, and on the other side the cells are sitting on another tissue. That is what we call polarity. Polarity means one side is sitting on another tissue and the opposite side is facing the empty space. That is what we call polarity. So once you see that, you are good to say, hey, this is the epithelial tissue. So look at that. You can see the lumen here, intestinal lumen, and you can see the cells here. The cells are pretty much multiple. You can see lots and lots of nucleus. And that is the epithelial tissue. Keep looking at that. Keep moving your microscope around. And now you get into detail with the high resolution lens, and you start seeing this. And you start seeing the individual shape of the cells. Now you can see. So as I say, like the cells, like one cell, another cell, another cell, they are sitting on the another tissue, which is the connective tissue. So epithelial tissue has to sit on the connective tissue. Connective tissue is something like glue in our body. They are trying to rip and touch and fix everything together like a glue, super glue, So epithelial tissue, epithelium, has to sit on the connective tissue. And as we remember, there are special connections in between the tissue. If we look at here, gap junction, tight junctions, and desmosome. A desmosome is something sticking together, sticking two cells together. Gap junction means there is a gap where one cell content can go through another. And tight junction, there is nothing can go through. And now you are looking at another microscope. I got these from Dr. Long, Jim Long. And now you can see the very polarity, like empty space on one side, multiple cells, cellularity. And this one is sitting on another type of tissue. And you are good to say, hey, this is a epithelial tissue. So these are the characteristics of epithelial tissue: cellularity, sitting on the supporting connective tissue, polarity. There is specialized contact. The connective tissues are avascular. There is no blood supply. They got their nutrition from diffusion from the blood vessels, but they have nerve supply. They are innervated and they tend to regenerate. So our skin is epithelial tissue. any tissue exposed to the external environment, like our skin, like our respiratory tract inside. Although they are tubular structure inside the body, they are exposed to the air we breathe in, and therefore they are lined by the epithelial tissue. Our gastrointestinal tract, like from oral cavity down to the anus, these are exposed to the food we digest and ingest, and therefore they are lined by the epithelial tissue. And they do regenerate, they do degenerate. And there are many functions of the epithelial tissue, as you saw, like protection, secretion, absorption, diffusion, filtration, secretion. So what I want you to go through is go to the book and just go a little bit, I will show you later, there are some pictures like which cell type has which function. And cell type, depending on the shape, one is flat, it is called squamous. It's like a scale, and therefore it is called squamous. Becoming thicker in a square shape, it is cuboidal. And it is become tall, that will be columnar. It's like a column. So that's depend on the shape. And if we put one layer of squamous cell, that will be simple squamous epithelial tissue. If we put multiple layer of squamous cell, that will become stratified squamous epithelium. Pseudo means it is fake. It is stratified means it looks like a multiple layer, but actually it is not. And transitional epithelial tissue is the cell change gradually from one shape to another. That is the transitional epithelium. Scale, cube, and column, squamous, cuboidal, and columnar. So these are the diagrams we have in our textbook. I think they are very good. So one flat cell, only one single layer of cell, which is the simple squamous epithelium. Where do we use it? We use it because it is flat, it is one layer. I mean, it is not for protection. It is for diffusion. Anything can go through this thin layer of cell. So therefore, they will be used in diffusion, filtration. So this sort of function. So we will use it in kidney. We use it in the lungs, at the end of the lungs, which is called alveoli, and in the blood vessels and lymphatics, where the gas exchange, nutrient exchange occurs. So very at the periphery, like very small blood vessel, which we call capillaries. So the main function is filtration and diffusion. Of course, it's a very thin and flimsy layer. So everything will go through and pass one side to another. Therefore, it is useful for diffusion and filtration. But let's say if the cells are getting bigger in a square shape, and now because the cell is bigger, it can function a little bit more. So there will be some secretory function and absorption function. So these cuboidal cells, we have some sort of secretion and absorption. Again, they will be used in the kidney, so that sodium, potassium, electrolyte, chloride, bicarb being reabsorbed and taken back, water, reabsorption, and secretion. So this sort of secretion absorption occur in the cuboidal epithelium. And of course, very tall cells mean a lot of space, which means they can do a lot of function. So they will absorb the nutrient, they will secrete mucus into the gastrointestinal tract, they will have enzyme protection. And if they are in the respiratory tract, there will be small little hairs, which is called cilia, then they will entrap the foreign material which comes in. So that's, we'll be using like gastrointestinal tract, or might be respiratory tract, something like that. So yes, here we have cilia. Then if we have cilia, it will be nice to entrap the particles, microparticles we breathe in the air. So that will be useful, like ciliated columnar epithelium. It is pseudo-stratified because it looks like multiple, but actually it is only one layer, pseudo-stratified. And squamous epithelium, flat cells, if you look carefully, flat cell but multiple layers. So stratified squamous epithelium. Here, stratified squamous epithelium, but we have a coat which is waxy layer called keratin. Then this will be keratinized squamous epithelium. So these are the functions in short. I want you to remember that, and because that will be in the exam. And glands in our body, generally we can divide the glands into exocrine gland and endocrine gland. Endocrine gland is deckless gland. Deckless means the gland doesn't have any deck, so their secretion, their hormones go into the blood vessel directly. Exocrine gland is secretion goes into the deck and then finally get into the body system. Like pancreas bicarb secretion, it is the exocrine function. Pancreas glucose secretion has endocrine function because insulin secreted from the pancreas will go directly into the blood vessel. Therefore, it is endocrine gland, and bicarbonate secreted from the pancreas is excreted into the gastrointestinal tract along the deck, and therefore sorry, therefore the pancreas has got two functions. Which is both exocrine and endocrine function. Sorry, guys. Okay.
You are still muted.
Okay, sorry. And now, oh. So Kopler cell, it is the example of unicellular exocrine gland. Exocrine gland means you have the deck to secrete into the body. So in our textbook, this is the page, which is, I think, is very good, I think. because it combines everything. So now if you look at these diagrams and compare with the small one on the right side, if you compare that, you can see the difference. On the right small diagram, you are seeing the very different histology slide comparing to what you see here. Look at that. Here is full of life, I will say. You can see multiple cells here. You can see the polarity, cellularity, and you are good to say, hey, it is the epithelial tissue. Now you start seeing something like that. It is pretty empty. There is an empty C here, and you can see cell here, one there, and one there. So that is the big difference between the epithelial tissue, which is fully loaded with cells, cellularity, and the pretty empty and easy, very calm, which is the connective tissue. So connective tissue is second type of tissues in our body. And underneath the connective tissue umbrella, we have 4 subtypes. So connective tissue proper, skeletal, bone. Our bone is a form of connective tissue. Cartilage is the form of connective tissue. Even the blood is a form of connective tissue. So what I want you to remember is, let's say if you're in clinic or if you're in a hospital, if you are doing blood transfusion to a patient, I want you to remember the blood is connective tissue. If you see a broken bone, I want you to remember bone is a connective tissue. If you see a cartilage damage, I want you to remember cartilage is the connective tissue. So our ear, like elastic cartilage, that is connective tissue. And of course, connective tissue proper, it is the connective tissue which the epithelial tissue sits on. So this slide is the connective tissue. So now we can see pretty empty, like a C here, and we can see the cell here. We can even count cells, individual cells, how many cells. We will not be able to do that with the epithelial tissue. So it has a big, large matrix and small number of cells. So if you look more carefully, you will see this. The matrix is made of ground substance plus the fibers. Fibers can be collagen fiber, elastic fiber, or reticular fiber. And the cells could be, let's say, fibroblasts. If we put fibroblast cell in the matrix, we will get the fibrous tissue. If we put osteoblast, which is the bone forming cell, we will get a bone. If we put a cartilage forming cell, chondroblast, we will get the cartilage. So it is just like a pizza. You know, the base is there. The base is made with ground substance and fibers. It depends on what we put on top. The pizza will change. It's vegetable pizza, or it is meaty pizza, or whatever. So the cell, there could be fat cell, there could be mast cell, there could be neutrophil, but these are the cellular component. The main cell which is going to change this connective tissue is the daddy. Daddy is here, fibroblast. If we put fibroblast, this connective tissue will change into fibrous tissue. If we put osteoblast, this tissue will change into bone. So connective tissue is made of cell and matrix and ground substance, of course. It has got small number of cells. We saw that. It has large amount of matrix. We saw that. There will be ground substance, and it originates from the mesenchyme. So let's say if I ask you a question, what is a bone? Then what would you say? Hey, what is a bone? Because you have seen bone every day. And what is a bone? A bone is a connective tissue. But it is not just a simple connective tissue, it is specialized, and therefore bone is a specialized connective tissue, which is made of cell, matrix, and ground substances. So that will be a way to answer like a few little silly questions. Like, you know, some people might ask you, hey, you're doing anatomy class. What is a bone? A bone is a specialized connective tissue, which is made of cell and matrix. In cell, there will be osteoblast plus many other cells. In the matrix, we have ground substance, collagen fiber, elastic fiber, reticular fiber. That's it. That's the full stop. So cell and matrix, as we say, like if we put fibroblast, we get fibrous tissue. If we put chondroblast, cartilage forming cell, we get cartilage tissue. If we put osteoblast, we get bone. And of course, on top of these life-changing cells, there will be a few other cells like fat cell, white cell, macrophage, and mast cell. And fibers, as you saw, collagen fibers, elastin fiber, reticular fiber. And the ground substance are proteoglycan and glycosaminoglycan. Collagen, what is collagen? It's a combination of 3 amino acid chains. That's it. So this is again, like this is a page in our textbook, which I think is really, really, really good. It just classifies the connective tissue in a very pretty way. Like it's a connective tissue proper, cartilage, bone, and blood. Bone can be further divided into compact bone, spongy bone. Cartilage can be hyaline cartilage, elastic cartilage, fibrocartilage. And connective tissue proper can be loose connective tissue or dense connective tissue. Bang. So this is a very good diagram. I want you to go through that and have a little study about this. And now we are comparing the epithelial tissue page. This is the epithelial tissue because of the cellularity and polarity. And on this side, we have the connective tissue, which we will say blood, bone and cartilage, and connective tissue proper. And now you start seeing the different types of connective tissue here, areolar connective tissue, adipose tissue. You know that it is at the bone here, the bone connective tissue. If you look at the histology, it will be like that. We come to that when we talk about bone tissue. And you will see the difference between the histology difference between the connective tissue and epithelial tissue, because lots of cells, not many cells. You might see cells here, multiple cells, but hey, it is pretty different from epithelial tissue. And now we will, so this is the epithelium, loose areolar connective tissue. It will look like that. You will see the matrix, you will see the cells here and there. This is the fat adipose tissue. And you can see the nucleus here and there, not a lot. It's no cellularity at all. But hey, if you look at that, this is slightly misleading because you might feel, hey, I can see multiple cells. Could it be the connective tissue? Could it be the epithelial tissue? But there is no polarity. and therefore it is more likely to be connective tissue rather than epithelial tissue. So number 3 type of tissue is mast cell tissue. And mast cell is a composite tissue because it is a combination of mast cell, mast cell tissue, which is wrapped and glued together by the connective tissue. So a mast cell is a composite tissue, and mast cell, it is made of mast cell tissue plus the connective tissue. And there are 3 different types of mast cells in our body, which is striated mast cell, smooth mast cell, and cardiac mast cell. So you are going to see 3 different types of mast cells, which is striated, which is smooth, or which is cardiac. Look at this diagram. You can see the mast cell here, which is long, which is cylindrical. You can see the striations here. If you look more carefully, you can see more striations here. Therefore, it is called striated mast cell. The particular point is they are big, they are long, and they are parallel. They do not go to each other. They do not communicate physically, grossly communicate with each other. This is the feature of skeletal mast cell tissue. Skeletal mast cell tissue is used to move the skeleton for our locomotion. So this is the skeletal mast cell tissue. I want you to keep looking at these mast cells are just small, like a squamous cells, multiple spindle shape, and they are called smooth mast cell because they do not have striations. If you look at that, you cannot see any striations here. And therefore, this is the smooth mast cell tissue. Keep looking at that. You can see some striations here. But the difference from the skeletal mast cell is these fibers they do branch, they do join here. They join here, they do branch here. So I'm going to show you the skeletal mast cell again. This is so parallel to each other. They do not branch, they do not join. And this is so branching and joining. And this is therefore, cardiac mast cell tissue is striated mast cell, but they do branch, they do join, and they are specialized. They are just for the heart. So the cardiac mast cell tissue will form the heart. So there is a difference here. You can even see it is not as big as the skeletal mast cell tissue, and they are here. You can see they're either branching or joining to each other, comparing to the skeletal mast cell tissue. So now you have 3 mast cell types, which are skeletal, smooth, and cardiac mast cell. Skeletal, long, large cylinder, multiple nuclei, repeated similar pattern of striation. Cardiac, striated, but only 1 nucleus. They do branch and they do join. Smooth mast cell, it is a long table, like, very flat cell, spindle shape, no visible striation. So again, like if you think this histology slide, let's say if you get this histology slide, and you know that this is not epithelial cell, you know that this is not a connective tissue. Yeah, you might think about that, hey, this is the matrix, you can see the small cell here. Just a little bit cautious in that point. But if you see the skeletal mast cell, you know that this is not a connective tissue. If you look at the cardiac mast cell, you know that that is not a that is not a connective tissue. It cannot be epithelial tissue, and therefore it must be muscle tissue, because the last remaining type of cell is nervous tissue. Nervous tissue, you are going to see this neuron. So this is the best example of histological example of nervous tissue, which is a neuron. Look at that. It is like a star shape or jellyfish or anything like that, with the multiple limbs coming out with the long axon and then just terminal button. So now I think it is pretty obvious 4 types of tissue in our body: epithelial tissue, connective tissue, muscle tissue, and nervous tissue. So this is a neuron which makes the nervous tissue. If you look at that, you will see here, we get to the nervous system, and this is a cell body, and anything branching out, big branch, small branches, they are called dendrites. And this one big sprouting from the body is called the axon. Axon, the dendrites will take information from the surrounding to the cell body, and axon will take information from the cell body to the periphery. So this is the anatomy of neuron, and neuron is the basic fundamental structural unit of nervous tissue, nervous system, because nervous tissue is nothing without neurons. So brain, cell body, dendrites, axon, and neuroglial cells. Neuroglial cells are the supporting cells which support the neurons, because neurons requirements are a lot. Neurons are highly metabolically active. Neurons, they cannot be repaired or they cannot regenerate, and therefore neurons need to be well protected, and therefore we need a cell which will protect the neurons, and these cells are called neuroglial cells.
Will we go later in the semester? Will we go deeper into like cells, like the sodium potassium pump and all that, or is it just an overview?
As cell sodium potassium pump, I would say not in anatomy, but we will, like for the anatomy, we will go deeper with the neurons. We'll go deeper with the skeletal muscle and that sort of stuff.
Okay.
Yeah. So sodium potassium pump, I will just leave it for the physiology class. And as I say, from like, if you guys want a cell lecture, we can go through that. And neuroglial cells, like their function of the neuroglial cell is to support and protect the neurons. They do form myelin, and they maintain the homeostasis. Homeostasis means very normal, neutral environment. So now I believe you all remember trillions of cells are classified and grouped into 4 types of tissue, which are these. And functional unit, it is the basic unit. For the skeletal muscle cell, it will be sarcomere. So when we talk about skeletal muscle, we will have to study sarcomere. It's pretty detailed, pretty intense. When we talk about nervous system, we have to study about neurons. When we talk about bones, we have to study about the osteon. And when we talk about the kidneys, we have to talk about nephron. So these are the basic functional units of the individual cells. So mast cells are made of sarcomeres. Mast cells are made of sarcomeres. Nervous system is made of neuron. Bones are made of osteon. And kidneys functional unit kidney is nothing without nephrons. So if there is damage to the nephrons, that kidney is destroyed. So even if with our naked eye, gross kidney, we are just seeing the kidney, that kidney does not function. So organ system classification. And now I'm going to go through a little bit of that. So in the exam, you will have similar histology slide. And the question will be, hey, where did you get this from? So epithelial tissue, so the option will be skin, bone, muscle, and nerve. So you know that this is a specimen of epithelial tissue, and therefore you will say, hey, this tissue specimen is taken from the skin. Let's say because it is skin is the epithelial tissue. You will have similar. I'm not going to be too difficult, but if I show you this histology slide, I want you to say this specimen histology slide is taken from a epithelial tissue. It is not taken from a connective tissue. It is not taken from the nervous tissue. It is not taken from the muscle tissue, because if you are taking a tissue from the muscle, you are going to see the muscle tissue. Again, like very highly cellular. Look at that, multiple cells, multiple cells, multiple cells. And on one side, there is MTC, and this must be epithelial tissue. And it is sitting on the basement membrane, which is the connective tissue. That's what we call polarity. Again, like look at that, this is a form of epithelial tissue because you can see multiple cells here. And it is resting on the basement membrane. And on one side, it is pretty empty. But look at that, the cell shape, multiple layer and gradually change. This is an example of transitional tissue, a transitional epithelium, which is a form of epithelial tissue. So I'm not going to ask, pretty detailed, is it a transitional epithelium? I don't think I have any question like that. But I will say, I want you to know, if you see that, hey, this is epithelial tissue. At least that's what I want you to know. And look at that. You can see the square cubic shaped cells in the lumen here, and you can see the nucleus. It is, these square shapes are not multiple layer, they are only one single layer. And this must be simple cuboidal epithelium. This is the histology slide taken from a kidney. So inside all kidneys, renal tubules are lined by the cuboidal epithelium. So, all right, so that's the end of this slide, and we will have to go through right. Let me get one more. So just a very short lecture about microscope. I don't think I have posted on the Canvas. I don't think I have sent it to you guys yet. It is very short. So micro means small, scope means to see, microscope means to see small things. So, so when did we start talking about microscope? Who invented that? We don't really know. So they expect that around 1620 in Europe, you know, they start inventing the microscope to make it bigger, to see better. And our lens, our glasses might be a basic form of microscope, you know, simple microscope. There are many different portions in the microscope. I will show you a video later, but what I want you to take is the arm and nose piece and the objective lens. Have a little look, and this is the few little things like eyepiece, neck or arm. This is the stage. This is the nose piece, an objective lens coming out from the nose piece. This is the diaphragm where the lights go in, and we put the slide on the stage.
Professor, I don't think we see your what you're seeing. We don't see the
Yeah, I don't
Oh.
see it on the screen.
Yeah, you're
Oh,
entering your
okay,
screen.
I'm sorry. I thought I have. Thank you for saying that. Otherwise, I will just keep going because I thought I have shared. So I'm just going to. Yeah, so like as micro means small, scope means see. To see small things, like, you know, like our eyeglasses might be the basic form of microscope because you can see smaller print more in detail. And who invented this microscope? No one knows, and they think it was around 1620 in Europe. That's the beginning of the microscope. And there are different portions of microscope which we need to familiar with so that we have a good communication between each other, you know. Like when you are holding a microscope and moving around the lab, what we need to do is we need to hold from the neck and we need to support from the base. That's the way we carry around. And this is the eyepiece. So let's say if a microscope eyepiece is missing, I want you to say, hey, this microscope doesn't have eyepiece. Rather than, hey, this microscope doesn't have that one. Then that way, it is just mainly for communication. Of course, we all know, you know, how to use a microscope. It is our basic biology lecture. But the terminologies like eyepiece, the nose piece, objective lens, the stage where we put the glass slide, and the diaphragm, fine focus, close focus, and that sort of stuff we need to know just for communication. So this is eyepiece tube, arm, nose piece, objective lens. So the same, like depending on the different department you go, you are going to see different shape and size and types, and different companies made a microscope. But most of the time, you know, the basic is the same. And I want you to remember, usually, if you look at that, we have like 1, 2, 3 objective lens, and that's the basic. The objective lens, scanning power lens is 4 times. So it will magnify 4 times what you are seeing. Low power, we magnify 10 times. And high power, we magnify 40 times. So on top of that, our eyepiece has got power of 10 lens. So which means if you are using a microscope with the scanning power itself has got 4 times, and your eyepiece lens has got 10 times, which means you are magnifying the structure you are looking by 40 times. So let's say we always start with the scanning power lens 40 times, and we look around, it's just a bad eyesight of you, we look around, and then once we see something, we zoom in and we use the low power, which is the 10 times. So 10 times plus the eyepiece lens, which is 10 times, we make it 100 times bigger. And of course, if we use the high power lens, it will make 40 times magnification. And if you want to go more, you can put wild and the wild emulsification, and you can do that. So field of view and details, if you are flying high, what you see down there is not very specific. It is just a blast, bad eyesight of you. But the more details you go in, the field of vision will get smaller, but you will get more detail. So this is a very good website here. And these are the good videos, which I'm not going to repeat. And whenever you see, you look at the microscope lens, always look at this magnification and field number. And field number is 20, magnification is 10. So that's the field number is the diameter of the image area when you see under the eyepiece. So hey, that next time, whenever you get a chance, look at the lens and you try to reach magnification and field number. That's the way we calculate field of view, field number, objective magnification. Don't go too deep into there. It is a little bit confusing. Therefore, I'm not going to talk a lot. But at least we need to know these and just have a look with what I have shown you here. So don't go anything more in detail. And the time we gradually absorb more and more. So if we start too much into detail, then we cannot back up and we will get fed up. So these are the little videos which are very useful, Have a look. So now I hope you're not too tired. Do you want a break, or shall I go to the next?
Let's power through it.
I'm okay going through it.
I'm good going.
Yeah. Stop screen share. And then so this is our Canvas page. If you go to module and go here, where are we? Introduction, tissue, and skin. We have skin homework already. I believe everyone get it. And now I have prepared for the end of January exam lecture and end of January exam lab. So it is just down here The lab, it is just more about safety, you know. Let's say if you are coming to the Solano College, if we are going into the lab, there is a form we have to fill in, which we don't ask the student to do because at the moment we are not going into the lab. Like in the lab, you know what you should do, what you should not do. You are not allowed to use any electrical instruments like mobile or iPod or something like that. You are not allowed to take photographs. You're not allowed to eat. You're not allowed to drink in the lab and that sort of stuff. And the tissue lab, have a look. I have a few videos which are very good. So I just keep showing to the students. They have, hey, what is this, Marcel? What do you think?
Striated.
Striated, Marcel. So how many striated, Marcel, do we have? 2, isn't it? Skeletal and cardiac. What is it then?
Cardiac.
Cardiac. Oh yeah. Why is that? They are branching and joining, I think. We could be wrong, but hey, that's a very educated guess. Yeah. What is this?
I'm gonna guess epithelial tissue.
Epithelial tissue. Okay, so I think, you know, here we might say epithelial tissue because there is a lumen here. You can see the cell here. So let's say if I say these white blotch, boop, 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 white blotch, then what do you think?
Adipose tissue.
Adipose tissue, fat tissue, yeah. Because now here, like as you said, it looks like because I think this is the blood vessel, therefore you are saying epithelial tissue because blood vessels, lumen are lined by the epithelial tissue. Yeah, that is correct. And it is like a lumen which is flattened. But let's say if you see this white, it cannot be epithelial tissue. You are not seeing any neurons, so it is not nervous tissue. You are not seeing any muscle tissue. So this must be connective tissue. And this is like, you know, sometimes we have to remember as a photographic memory. It's just like little white, very thin, and you can see the nucleus here and there, but that is the adipose tissue. So I think these were okay. This is so these videos are really nice. I like that. So therefore I cannot delete them. And the lab 2 tissue and skin. Yeah, again, these two, you know, especially these 2-3 videos, they are really, 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 really good. And therefore, you know, if you have time, have a watch, like when you are not doing anything, like when you are relaxing, and just have a look, and then it doesn't take long because they are very short videos. And for the skin, yeah, we have it. And the skin lecture. So end of January exam, let's go there. So I always do, you know, 1 question, 1 point. I do not use 1 question, 2 points. The reason is if somebody make a mistake, then they are going to lose only 1 point. If I use 2, then there will be 2 points difference, and that's a big hit, if you only make 2 mistakes and you lost 4 marks. That's what I do not like, and therefore I use only 1 question, 1 point. If you make 1 mistake, you only lose 1 point. And you will have like 30 questions, you will have 30 points. The time limit, I would say, 45 minutes. So it's plenty for you guys. Attempt is twice. And January 25th. Hey, it's today. Okay, let's have a go. Let's have a little go about this. So the microscopic study of tissue structure is also called, what is that?
Histology?
Histology, perfect. Here, in anatomical position, the term is to the little finger.
Lateral?
Lateral. You are scoring 100%. Little finger is blank to the thumb.
Is it proximal?
Little finger here and there.
Is it proximal?
And little finger is here. Thumb
Oh.
I
is
think it's
here.
medial.
Medial.
I was thinking it was medial too.
Yeah, medial meaning closer to the
Closer
center of the
to
body.
middle,
Yeah,
usually,
closer
yeah.
to the midline. Yes. I'm not going to show this. Opposite of ipsilateral.
Oh my God.
Contralateral.
Contralateral. Humerus is blank to the radius and ulna.
Superior,
And superior means is it
above.
above
Above,
or
closer to the head.
we use the term proximal, isn't it?
Proximal, okay.
Proximal and distal. This section is
Transverse. It's transverse.
transverse or axial, isn't it? Transverse or axial. And this section is
No,
yes, sagittal. That's right.
it is, okay, good.
Yeah. How about this?
Coronal.
This be
Oh.
transfer,
Coronal. Oh my God.
was-
No other answer. Cartilage is made of blank, matrix, and ground substance.
Cell?
Yeah, cartilage forming cell. What do you call that?
Chondroblasts?
Chondroblast. Oh my God.
Okay.
And this body cavities.
Thorax?
Yeah, body
Just-
cavity A. Here the question is
Dorsal?
I know B. I know
Dorsal cavity, there we go.
Yeah, dorsal.
Yeah.
You're studying the slide. And multiple. Hey, you are studying a histology slide using a microscope. You see multiple layers of squamous cells. This multiple layer epithelium in anatomical term is
stratified.
stratified. Main function of the simple squamous epithelium.
Diffusion and
Secretion,
Diffusion, isn't it? Diffusion and
Secretion.
filtration.
Yeah.
Because you are using a very fine thin tissue here. You are not going to protect anything.
It's
You
only
will
one layer,
filter it,
yeah.
And bone is made of blank formicell matrix ground substance, which is cartilage formicell is chondroblast. Bone
It's cytoblast? No, it's,
Fibroblast
my God.
is fibrous tissue.
I know the name.
Bone formicell is
Osteoblast, there we go.
osteoblast. And this view is
Is that multiple pictures?
multiple pictures. I show you.
It's from the side. Is it lateral? Because it's from the side?
Yeah, from the side, it is not lateral anymore. It is
Sagittal. Sagittal
It's,
plane.
sagittal plane. Yes.
Oh, we're talking about planes. Okay.
Yeah, this is the sagittal scan of the MRI scan. So that's, what I want you to take is when you finish this class, and if you go into the, let's say, radiology, you will be able to communicate with those guys. That's all I want. And of course, finally we gradually get into the spine, anatomy, and that sort of stuff. So you know that this be, hey, what is this? Look at the diagram and answer the question. The following radiologic investigation was performed in
Transversal.
transverse or axial, isn't it the same? Yeah.
Are you gonna accept both transversal or axial?
Yeah,
can do
transverse
either
or
or.
axial.
Okay.
So now, this patient is an elderly patient who came to emergency room with loss of consciousness. That old lady was found on the floor by her neighbor, and they did a CT scan of the head, and they
Had an aneurysm.
aneurysm, or what is this white dense?
That's the blood from hemorrhaging from the head
Blood from
injury.
hemorrhaging, yeah, could
Form
be
synapses,
anything. Have an open mind, could be from aneurysm, could be from trauma, or they might be on apixaban and they just bleed inside the brain spontaneously. Or like when you get old, the blood vessels are no longer dilated, but they become gradually rigid. And once there is a sudden pressure surge, they cannot.
You could have a blood clot and just have a stroke. Just it goes to the brain and then burst.
Yeah, many things happen. The way I see is the most common cause for death is, for me, it is age. You do not need many other reasons, like just because of old age people die. So the age is the very important factor for life and death. And on the CT scan, the blood is very white, very dense. We call this terminology hyperdense area, which is the bleeding. Okay, this patient has bleeding in the brain. Which side's bleeding? Is it right side of the brain, or is it brain?
Let's see if that's the front of their brain. It would be their right side.
Right side?
That will be the left side. As I say, I want you guys to keep it simple. Your right side, you put them in their place, and you are lying flat. And this is the right side. This is the left side. Yeah.
Wait a minute. Where did the eyes?
The eyes, it is just in the brain level yet. Only it comes down here. You will see the eyes.
Yeah, because I was thinking the top was the backs.
Yeah. So
Was the front. Oh, okay.
this is the forehead, frontal. This is the occiput region. This is the right. This is the left. So the section is stay in this plane. So at the top. So it will gradually come down. It will gradually come down. And once it is low enough, you will start see the eyes. And this is the right side. This is the left side. Just keep it simple. And tape mentioned otherwise, right side is right and left side is left. And this is the, as you guys say, axial or transverse section.
Wait, is the top the front of their face?
Yeah, the top is the forehead. So the patient is, because in the CT scan, the patient is lying. And if they are lying, let's say I'm lying, and then if they're doing the section, axial section like that, we see like that. This
Well,
is a
if they're
very,
lying, wouldn't the right be on that side? Because if that's the front of their head, they're lying down, that would be in the right, where your mouse is. Or
they're lying, and you have to say this is the right side and this is the left side.
It's like a reverse image, like if you're looking in a mirror.
that just okay.
So just keep it simple. The image right side is the right.
So it's the left side?
So left side bleeding. Okay, if they have a bleeding inside the brain on the left side, which part of the body is going to get paralyzed.
Wouldn't it be the right side?
Yes, yes, because about 85% of the nerve fibers from the left side of the brain will cross to the right side and will give nerve supply to the right side. So from right side, I'm not sure you are seeing correct because now we are in the camera. So this is my right hand, my right side, the bleeding in the right side, the nervous tissue from the right, 85% we cross to the left and then give movement and sense.
Wait, so, okay, they're laying down on a flat plane. The very top is their eyes or where their forehead is.
So the
All
forehead
right, so if
here,
you're looking at them face down,
no, it is not face down, the face is up.
yeah, the face is up.
So this is the forehead.
Oh, you know what? Yeah, you're right. That is the left side. Okay.
Yeah, so the answer will be the left side then. Yes, it is left side. And now I am going to take you, hey, what is blood?
Connective.
Eh? What type of tissue is it?
Connective
Connected.
tissue.
Connective tissue, yeah. So
Connective.
every time you see a blood transfusion, I want you to remember blood is not just a juice, it is a connective tissue. Simple cuboidal epithelium function.
Secretion and absorption.
Perfect. Main function of the transitional epithelium. You saw the transitional epithelium? There are not many transitional epithelium in our body.
Wait a minute. Would it be like the stretchy?
Yeah, stretchy one.
So it'd be for your urine, right?
Yeah, so
your bladder and stuff. So the main
yes.
function would be to,
So yes, transitional epithelium is bladder. Yeah. So there are not many transitional epithelium in our body. It is just the bladder because after the bladder shrink. Once you are sitting for a long time trying to control the wee, the bladder gets stretchy, and it is waterproof.
Mhm.
Is that the same as the uterine muscles? Or,
Urinary muscles. Let's say the whole urinary system.
oh no, I meant the uterus
Uterus,
because it stretches and shrinks.
and that's the smooth muscle.
Okay.
Yeah, so uterus is smooth muscle, but inside the uterus, it is lined by what sort of epithelium would be?
Simple
Sorry,
squamous.
yeah, because uterus is secreting, isn't it?
Yes, it'd be simple squamous.
A simple squamous will be the function of the simple squamous is for filtration and
Filtration and
diffusion.
secretion,
So
yeah.
the lining, the uterus lining, we have to secrete something.
So it'd have goblet cells, so mucus.
Mucus
So-
or the columnar epithelium.
Yeah, so it'd have cilia at the top and, okay.
Yeah. So main function of the stratified squamous epithelium are
Protection, let's see, would it be secretion and absorption also?
I think it's
Or
mainly for
diffusion?
protection. Let's see what I have written here. Loading, resistance and protection. Yeah. So yeah, because it is multiple choice. So once you see, it should be easy for you guys. There are multiple options. Cuboidal epithelium, columnar epithelium. I'm not going there. Haha, this is again easy for you guys. You are in ER. Patient taken into the ER after being shot in the right upper quadrant of the abdomen. The organ most likely to get injury is
Liver?
liver. Yeah, perfect. So I'm not sure what I have put there, but that's the right upper quadrant organs you are thinking of, isn't it? So you are again the same question. Step in the left upper quadrant of the abdomen. The organ most likely to get injured,
The stomach.
stomach and
There's a spleen and the diaphragm.
yes,
Right,
spleen
yeah.
could be, like especially spleen is easily forgotten because let's say when you're playing American football, like big hit to each other, and let's say if you are not lucky enough and big blow to the left upper quadrant, left chest wall, the spleen is just underneath. And initially the spleen bleeds and try to contain. And the bleeding is just small. And these guys, like tough guys, and they just fine, they just want to go back. And finally, another minor injury, then that bleeds from the spleen, just wow. And then that's the way, they got injury to the spleen. And lower quadrant, the skin, that is easy for you. Which makes the skin pigment melanin?
Melanocytes.
Melanocyte, oh my God. Epidermis of the thin skin has only 4 layers. Epidermis of the thin skin lacks which layer?
Thin skin lacks the it's the
Yeah.
liminal or lumen? No,
Lucidum.
Lucidum.
lucidium, yeah.
Yeah, lucidum. You try to
It had to be
remember
something with an
Lucy.
L, yeah.
Yeah, you try to remember Lucy. Yeah, Lucy is lucid. It is very thin and clear. Lucid, that layer, you don't really need it for the thin skin. And melanocytes are found in sebaceous gland in the skin produce nail anatomy. Erector pili mast cell. Hey, I'm not going to tell you, just have a little look about erector pili mast cell. You might get it from the question bank. I think this is, that. Stratum lies between the stratum basale and stratum granulosum. What is that? Okay.
Spinosome.
Spinosome. Okay, let's remember 5 layers of the skin. Like 2 layers, like epidermis and dermis, isn't it? Dermis is connective tissue layer, epidermis is epithelial tissue. Epithelial tissue, dermis layer, epithelial layer, we divide into 5. They are stratum basale. Next is, as you say, spinosum. Next is, as we see, granulosum. Then lucidum, and then corneum. 5 layers of the epidermis. Yeah. Sweat, have a little read about sweat. I'm not going to show you. And
What about like the
tattoo.
basement layer? Do we have to remember that?
The basement layer is basally, is base.
Okay. And then just basement, or not basement, then just dermis.
Then dermis. Dermis has 2 layers. Have a little, so tattooing, like if you have tattoo, you need to know where the pigment has gone into your body. This little anatomy of the fingernail. Elasticity of the skin is mainly due to, that's easy one. Hey, look at that. Outermost layer of the epidermis is stratum corneum. Stratum corneum is mainly made of what?
Isn't it dead keratin?
Ah, my God. In the epidermis, which layer has most living cells? So in the epidermis, we have 5 layers from basale to corneum. Which layer has the most living cells? You need,
Basale.
yeah, basale, because it is very base. close to the dermis,
Mm,
close to the
Makes sense.
nutrition. So therefore, basale is rich, and therefore they have a lot of living cells. Another nail anatomy, elastic cartilage. Example, elastic cartilage.
What are ears?
Or-
Yes, yes, isn't it? I'm not
Not the
sure
same.
what I have put. So there are 3 types of cartilage, like elastic cartilage, hyaline cartilage, and fibrous cartilage. Elastic cartilage means the property elastic. Elastic means you can deform it, and if you release the deforming force, it will go back to its original position. That is what we call elasticity. So if we twist our ear as much as we can, if we release it, the ear will go back to its normal position because ear is made of elastic cartilage. And that's the difference between elasticity and plasticity. Plasticity means like you try to deform it, and then finally it will not go back to normal. It will just go back to some degree of normal. That is the plasticity. So now this is the elasticity. This is superficial and deep. You know that. The superficial and deep, you know that. Aha. So I hope it is not a big deal for you guys. It is open until 1st of February. So it is 1 week. I believe you all, we have a chance to do that.
Since the quiz isn't published.
Yeah. Oh,
Here we go.
here we go. Thank you for reminding me. I always forget that sometimes, you know, I have to change the date, and I just, and now let's go to the lab exam. So you have done 30 questions for the lecture. So I will give you only 15 questions for the lab so that you don't, this exam doesn't really trouble you for the, you know, doesn't really bombard you with the exams. And but yeah, exam is a good way to give marks, and exams are a good way to do assessment. And therefore, I think they are very useful. Like again, like, so 50 questions, 25 minutes, allow attempt 2, we take the highest, to everyone, January, February, and let's go. I'm not going through, I hope you all know this. I hope you all know this. I hope you all know this. These are the histology slides. What is this? So you are now looking at a histology slide.
Those look like, I mean, they look like goblet cells, but I don't know.
Let's say, let's start with, like, you know, always think about 4 types of tissue in our body. So is it epithelial, or is it nervous, or is it mast cell, or is it connective?
I'm gonna guess connective.
That is the correct answer. Yeah, connective. Because it is not epithelial, isn't it? Epithelial tissue is gross. It's here, this is epithelial tissue. And this is the connective tissue. We don't know what type of connective tissue and how many types of connective tissues in our body.
2.
4, isn't it?
Oh,
The 4 types of connective tissues in our body, they are connective tissue proper, cartilage, bone, and blood. You might say, hey, it could be blood, you know, blood cells, RBC floating around. No, blood is a little bit red. So it is not blood. So you might want to think about, is it bone, or is it cartilage, or is it the connective tissue proper? Then I would say this is more like a hyaline cartilage, not a connective tissue proper. So if you go and look back the slides from the connective tissue proper, I mean, it is different, and therefore this is a hyaline cartilage. And let me check. Yeah, this is cartilage, skin. If you have a skin specimen, what are you going to see? So I will give you a slide, which is, hey, Marcus, this is a specimen taken from the skin. Then what do you expect to see then?
If it's just like skin,
Yeah, so you will see.
like you'd see like stratified squamous epithelium. You'd
Yeah,
see like
so you will see
lumen- yeah.
epithelial cells, isn't it? Let's say if I take a piece of brain, put it on the microscope, and then look, hey, this is a brain histology slide. Have
The
a look.
nervous.
Nervous tissue. So what sort of cells are you going to see? You are going to see
Neurons?
neurons.
Oh, yeah, neurons.
Yes, neurons. It's simple, isn't it?
Well, I was thinking, I was like, well, I just said, nerve, like, yeah.
Yeah, so even the nerve, is made of neurons. So piece of brain, neurons. And mast cell, you might see 3 types of mast cell. Is it striated or non-striated, smooth? Striated, are they branching or are they not branching and just big and running parallel? Then that will make it skeletal and cardiac. So it is not a bad exam, I think. And I am going to save and publish it.
When's the lab exam due?
At the same, like 1st of February.
So I see that we have 2 attempts for both of the exams. Is that a policy that you have for all exams or just for the first one?
And it is for the end of the month exams.
Okay, got you. What
Yeah.
other exams would we be taking besides the end of the month exams?
So like, yeah, every month, we should do an exam. It's just like exercise, and the assessment as well. So like end of the month, like nearly roughly, because some months like February might be a little bit short, something like March, April, they are big and more lectures, then we will have more burden for the exam. So we try to close the gap and expand the topics. So let's say nearly at the end of the month, we do an exam. This exam will be like 2 attempts, but final exam will be only 1 attempt. And the way I see is, if you have another chance, you do that. When you are doing exam, you are stay studying, and if you are studying, it's more better memory come in your mind. So that's the way I see it.
Can you take an exam and then take it again a few days later, like with the multiple attempts?
Yeah, multiple attempts, until February 1st.
And do we see our score after we finish it?
Let me check that. Let's do this, see their quiz response. Only after their last attempt. Haha. Only after their each attempt. Where shall I click? I don't know what you get, guys.
Just let
I
just
like
let
the
us see
middle
the,
one.
the correct answers.
I like
I'm
the
not
last
sure.
one.
My hands are
The
shaking.
last one is probably the best.
Let's do the.
Let's
do
do what Marcus said. The last one.
I'm sorry, my hands are shaking. So each attempt, I think that's fair, isn't it?
Well, you see, the correct answers is we could go back and we could study and see like, oh, we got these ones wrong. Let's see, next time we'll just do this right. Yeah.
Yeah, so this is good option, isn't it? Is it what you're saying?
Yes, I think that's fair.
That's fair. I will sit in the 50-50 bang.
Yeah. Okay.
Yeah, so that's for the lab. So we will change it to the but I have to warn you. If I go to quizzes, so these are the quizzes I have. So for the final exams, all the questions will come from the question bank. Like here, we have 32 questions. Here, we got 10 questions, 12 questions. So it is going to be a big bank. So it is a little bit daunting. So the best way to tackle this problem is do the homeworks, do the homeworks multiple times until you got the score you want. So because the more homeworks you do, like you are taking more questions from the question bank, and therefore you are practicing more. So which means like when it comes to the final exam, you have practiced quite a lot already. I hope that makes sense.
Yeah, that makes sense.
Because, as you see, like in that one question bank, there are 32 questions. So you are going to only get like about 3-4 questions from that question bank. So, the more you do. So, but at least this is a little flavor of the class. So we try to meet on Monday, Tuesday, Wednesday. And the way I see is if I push you with another lecture today, you will feel like bombarded with the lectures after lectures after lecture. And I think it is good to revise what we have learned. And now we know which is clear in our mind and which is not that clear. And I hope we can make it a little bit more clearer. And so Monday, Tuesday, Wednesday, starting from 6 p.m. we meet the same Zoom link. If you want to know what we are going, then we just look at the syllabus at the end. There will be tentative course schedule. Like we might need to change and adjust slightly. And the way I see is like after 3-4 lectures, I prefer to do revision so that you are not learning anything new. You are just going back to like previous 3-4 lectures. So that is time consuming, but because we are getting three days a week, that is quite a lot. That is quite a lot. So which is good. And let's say once the school reopened for the lab, then we jump in and I hope we don't need to what I was going to show you. Go syllabus and objectives. Yeah. So for tomorrow, we will be doing the bones and skeletal tissue. I'm sorry, I didn't do the revision for the skin because it is just done. And tomorrow lecture will be on bone and skeletal tissue. I hope that's okay. So which means we are stay a little bit early. And here again, like end of February exam, finish lecture topics review. So that is good. You know, after a few lectures like bone, joint, skeletal muscle, endocrine, lymphatics, then we stop again, and then we just go back and study what we have learned so that we can consolidate our knowledge. So that's the only way, you know, that we stay in our mind. And here I put to be checked. To be checked means we might pull the endocrine lecture here, or this skeletal muscle tissue is pretty daunting lecture. You know, it is very detailed and very basic. So we might spread for 2 days. So let's see what we can cope with. Yeah. Oh. Okay, has anyone got any question?
Will you be uploading this lecture on Canvas tonight?
Yeah,